Hello, I am Dr. Sangeetha. Oocyte freezing or egg freezing. We can store the women's eggs for a longer time now, and with the higher techniques, evolving science, we can definitely halt the aging of the eggs. Suppose a lady wants to go on a space trip. Her profession is something related to space. It will take years to come back. We can advise her to store her oocytes so that can be used whenever she wants to conceive. So there are so many indications for egg freezing. It can be social, it can be, as I said, occupational, it can be due to malignancies, like when a lady is undergoing cancer treatment. Sometimes she might undergo chemotherapy or radiotherapy or other cancer surgeries. So we'll have to always keep in mind or keep the reproductive medicine specialist in the loop so that there is an option for her to freeze the eggs. So whenever somebody tells there is cancer, young age, they are only worried about cancer. What next? Now so many things can be cured. After you cure your cancer and then one fine day you come to know that your ovaries are not having any more eggs, you will have to go for donor oocytes. So you have to always think beforehand. Counseling should be done. It's a teamwork between the reproductive medicine specialist, oncologists and other people, so that there is an option now. You can store your eggs before the such harsh treatments which can damage the eggs. So definitely these eggs can be used when after you get married or after you plan for pregnancy, and then they can be again thawed back and we can do the culture with the sperm, or we can inject the sperm and transfer the embryo back into the uterus. So you will have your own baby and you don't have to worry about the loss of eggs anymore. And there are, as I said, other indications. They are career oriented. They don't want to conceive now due to other personal or social reasons or family reasons. They can again go for storing of the oocytes. And definitely it doesn't cost more. Overall IVF charges plus few thousands more is not too much for when we compare her to having her own baby instead of losing her oocytes. Yes, definitely the cost is not very high. You can go for oocyte freezing whenever it is indicated. Egg freezing might not be advisable after 38 years of age. Of course, it can be changed on case-to-case basis. The ovarian reserve should be good. A woman who is just entering her perimenopausal age, or if she is undergoing oopause or ovarian reserve, she will have to undergo cycles of ovarian stimulation and retrieval to freeze her eggs. Even such candidates we don't prefer for egg freezing. That is one important thing is age. And if there are any other problems, like it cannot be stored in all women with cancers. Examples of blood cancer, if we store that, it can sometimes, especially ovarian tissue freezing, cannot be done. Of course, ovarian oocyte freezing can still be tried, but ovarian tissue freezing cannot be done in blood cancer patients. So only thing you have to consider the age and other genetic or chromosomal problems associated in your family or other family history, so that you should keep in mind before freezing your eggs.